Which condition is characterized by an irregular pulse rhythm? A. Bradycardia. B. Tachycardia. C. Arrhythmia. D. Hypertension. The correct answer is C. Arrhythmia is a condition marked by an irregular heartbeat or pulse, where the rhythm is not consistent. Where is the carotid pulse located? A. Wrist. B. Neck. C. Ankle. D. Elbow. The correct answer is B. The carotid artery is found in the neck. It's often checked during emergencies to quickly assess circulation. Which pulse site is located behind the knee? A. Radial pulse. B. Popliteal pulse. C. Femoral pulse. D. Dorsalis pedis pulse. The correct answer is B. The popliteal pulse is located behind the knee. You can feel it when the leg is slightly bent. A slow pulse rate is referred to as A. Hypotension. B. Hypertension. C. Tachycardia. D. Bradycardia. The correct answer is D. Bradycardia is a condition where the heart rate is slower than normal, typically less than 60 beats in adults. What is the normal resting pulse rate for adults? A. 40 to 60 beats. B. 60 to 100 beats. C. 100 to 120 beats. D. 120 to 140 beats. The correct answer is B. A normal resting heart rate for adults falls between 60 to 100 beats. This range signifies a healthy heart rate at rest. The apical pulse is measured at A. Wrist. B. Ankle. C. Chest. D. Neck. The correct answer is C. The apical pulse is located at the apex of the heart, which is in the chest. It's frequently used to assess the pulse in infants and people with heart conditions. What is pulse oximetry primarily used to measure? A. Heart rate. B. Blood pressure. C. Oxygen saturation. D. Respiratory rate. The correct answer is C. A pulse oximeter is used to measure oxygen saturation levels in the blood. It's often done using a device placed on the finger. What is considered a normal pulse rate for a newborn? A. 80 to 100 beats. B. 100 to 120 beats. C. 120 to 160 beats. D. 180 to 200 beats. The correct answer is C. Newborns typically have a faster pulse rate than adults, ranging from 120 to 160 beats. What might a pulse deficit indicate? A. Normal cardiac function. B. Blood pressure fluctuation. C. Heart arrhythmia. D. Adequate oxygen levels. The correct answer is C. A pulse deficit happens when the heart's contractions aren't strong enough to produce a detectable pulse at peripheral sites. This often points to the presence of a heart arrhythmia. The pulse at the groin is called A. Radial pulse. B. Femoral pulse. C. Popliteal pulse. D. Temporal pulse. The correct answer is B. The femoral pulse is located in the groin area. Checking this pulse helps assess circulation to the lower body. What is the primary purpose of checking the pulse? A. To determine respiratory rate. B. To assess heart function. C. To check blood sugar levels. D. To measure blood pressure. The correct answer is B. Checking the pulse primarily serves to assess heart function. By determining the heart rate and rhythm, we can gain insights into how well the heart is working. What condition is likely if a person's pulse is consistently over 120 beats at rest? A. Normal health. B. Bradycardia. C. Tachycardia. D. Hypertension. The correct answer is C. A persistently elevated pulse rate exceeding 120 beats, especially at rest, might indicate tachycardia, which could require medical evaluation. Which of the following is not a pulse site? A. Radial artery. B. Ulnar artery. C. Tibial artery. D. Renal artery. The correct answer is D. While the renal artery supplies blood to the kidneys, it is not a location where the pulse is typically checked. Which of the following might lead to an increase in pulse rate? A. Cold weather. B. Hypoxia. C. Meditation. D. Fasting. The correct answer is B. Hypoxia, or a lack of oxygen in the tissues, can trigger the body to compensate by increasing the heart rate to deliver more oxygen to vital organs. Which pulse is used for blood pressure measurements? A. Radial. B. Femoral. C. Brachial. D. Popliteal. The correct answer is C. The brachial pulse, situated in the arm, is commonly used for blood pressure measurements using a blood pressure cuff. Which of the following does not affect pulse rate? A. Exercise. B. Fever. C. Emotions. D. Hair color. The correct answer is D. Factors like exercise, fever, and emotions can influence pulse rate, either increasing or decreasing it. However, hair color has no impact on pulse rate. What term describes a pulse rate over 100 beats? A. Bradycardia. B. Tachycardia. C. Hypotension. D. Hypertension. The correct answer is B. Tachycardia refers to a heart rate that is faster than the normal resting rate, exceeding 100 beats. Which artery is most commonly used to check the pulse in adults? A. Carotid artery. B. Radial artery. C. Femoral artery. D. Brachial artery. The correct answer is B. The radial artery, located on the wrist, is the most common site for checking the pulse in adults because it is easily accessible and provides an accurate pulse reading. What does a weak and thready pulse indicate? A. Normal blood pressure. B. High blood pressure. C. Low blood pressure. D. Elevated oxygen levels. The correct answer is C. A weak and thready pulse often suggests low blood pressure and poor circulation. This indicates that the heart is not pumping blood efficiently. Which of the following increases pulse rate? A. Hypothermia. B. Sleeping. C. Fever. D. Relaxation. The correct answer is C. Fever leads to an increase in the body's metabolism, causing the heart rate to rise in order to meet the body's increased oxygen demand. Which factor does not usually decrease pulse rate? A. Deep sleep. B. Hypothermia. C. Stress. D. Physical inactivity. The correct answer is C. Stress usually triggers an increase in pulse rate as the body activates its fight or flight response. Unlike sleep or relaxation, which slow down the heart rate, stress elevates it. What pulse site is commonly used in infants? A. Radial pulse. B. Carotid pulse. C. Brachial pulse. D. Dorsalis pedis pulse. The correct answer is C. The brachial pulse, found in the upper arm, is commonly used to check the pulse in infants because it's easier to locate. A bounding pulse is usually associated with A. Dehydration. B. Anxiety. C. Low blood pressure. D. High blood pressure. The correct answer is D. A bounding pulse, which feels strong and full, is often observed in individuals with high blood pressure or during periods of excitement or exercise. Which site is best for assessing the pulse in an unconscious adult? A. Radial artery. B. Carotid artery. C. Brachial artery. D. Dorsalis pedis artery. The correct answer is B. The carotid artery, located in the neck, is the preferred site for checking the pulse in unconscious adults during emergencies. It offers a strong and easily accessible pulse. The dorsalis pedis pulse is located A. In the neck. B. On the top of the foot. C. In the groin. D. At the wrist. The correct answer is B. You can find the dorsalis pedis pulse on the top of the foot, near the base of the toes. It helps assess blood flow to the feet.